The Zambia National Union of Health and Allied Workers has accused the Ministry of Health of failing to register community health associations, saying it is undermining the delivery of quality primary health care. Union Chairperson Charles Mwila told Crown TV News in Lusaka that despite repeated appeals for a recommendation letter to enable the associations operate, the ministry is yet to respond. Mr. Mwila says primary health care is important in detecting ailments and diseases within communities, warning that delays in registration risks weakening frontline health services. Here's a report.
Not very long from today, His Excellency President Hakainde Hichilema made a directive to say all the people that did their voluntary work during the outbreak of COVID, cholera, they should be employed.
The pressure on Zambian clinics is getting heavier, and the Zambia National Union of Health and Allied Workers says one reason is paperwork stuck at the Ministry of Health. Association Chairperson Malema Charles Mwila has told Crown TV News in Lusaka that the ministry failure to register Community Health Association is holding back quality primary health care.
Right up to now, we've done all that we needed to do to formulate an association. We've gone to this and that, all those offices that are needed in order for the association to be formulated. The only office where things are still stuck, it is at the Ministry of Health, where we did the paperwork. We presented even our constitution. Our constitution, we were told to say, give us time.
Mr. Malema says repeated efforts to get the recommendation letter so that the association can operate legally have been made, but the Ministry of Health has not yet responded. He explained why it matters. Primary health care is where most ailments and diseases are first spotted in communities.
The only thing that awaited was the letter of recommendation from Minister of Health. And we requested for that. To date, we have not received, I think a year and maybe 6 months down the line, we have not received anything. We've tried to be there and ask them as to why. At times we were told regret. At times we were told, no, we are going to write back to you. They have not written now. I just want to emphasize or talk about the reasons why we need community health workers in Zambia. Like I said, there are ailments, there are diseases out there that are in the community that are not even known by government to start with. These are frontliners. These are people that go in the community and fish out those ailments.
Without formally registered community groups to help, he said the burden will keep piling on nurses, clinical officers, and other health personnel. To fill the gap now, Mr. Malema has revealed that his association has already recruited over 1,000 community health workers across the country.
You cannot have a doctor without those people in the community. Neither can you have a nurse. Look at the ratio, patient, doctor, patient, nurse. It is way back below par. So by formulating this, we feel government is going to benefit. And the local communities there. We will not be having those dates, BIDs, brought in date. Why? Because there were people that did not look after those that were in the communities that were sick. And at times you find the outbreaks, they are there in the community. And these are the link between government and the communities. So as Zambia chapter, PSI, we thought coming together, forming an association, it would help even Zambia as a nation to achieve those millennium goals that we boast about.
But until the minister signs off, he warned the system will keep running on goodwill instead of proper support, and patients will feel the strain. Anton Chomba, Crown TV News, Lusaka.
We take our final break. When we return, we look at sports news. We'll be right back.